Welcome to the next episode of DDS Admission series. Today we have with us Shreyash Oza, who graduated in 2013 from UCSF School of Dentistry, practiced for 5 years, then again he is back at UOP with his endo residency.
6 years.
6 years? Oh, okay, okay, that's okay, my bad. So we are here at beautiful beach of Big Sur in California, and today we'll be discussing about how do you select a dental school. Let's say you have a good headache. You have acceptance in 2 different dental schools, and let's see if we can solve it, right? So what do you think, first and foremost, what is the most important thing while selecting a dental school?
If you have family in the United States, I think a lot of people would put that as the first preference.
Absolutely.
A lot of people choose to be close to wherever their relatives are.
Right.
And I think it's an excellent choice to make too, because DDS can be a very stressful program, right. So you should have all the support that you can get.
Absolutely makes sense. I completely agree with you, especially with young moms they have kids 2 years, 3 years old, they don't want to stay away. Like, even if the school is really expensive, but make sure that there is no cost to family. The family is priceless, right? So absolutely. First and foremost, select your school which is closest to your family. So next point would be, I would say, economics.
Absolutely, the cost of the program. Sometimes if the cost difference is marginal, then you can choose to neglect it. But right. If it is a significant difference, then it can lead to several years of loan payment added, which can make a big difference to your long-term financial goals.
Absolutely. And what would you think would be that significant difference in your perspective?
So that's a really good question. The way I would think about it is by factoring in other aspects that go into picking your school. For example, the location.
Right.
If I have a slightly more expensive school in a place that I really want to be, versus a slightly cheaper school in a place which I would not want to be in for the next 2 or 3 years of my life, then I think I would go for the slightly more expensive school.
Absolutely, and that makes sense. In my opinion, when the difference is maybe 20,000 or something, but let's say the difference, my cutoff would be somewhere $40,000 to $50,000.
Yeah,
because on top of that, you're paying for next 2 years tuition for another 6% loan.
Right.
And if you're like 2 years, but then you will spend paying another 1 year just to make that difference.
Absolutely.
So make sure you go to one of the cheaper schools. It's okay to not have beautiful California beach like this, but we are lucky, or maybe we didn't have a choice. But if you have a choice, select one of the cheaper schools.
So and I would actually, that brings me to my third point, that you should factor location.
Location, yes.
Because if you're a young single person, and,
right.
If you're in the US by yourself,
right.
You don't want to spend what can be the next 2 best years of your life.
Absolutely.
In a place where there's nothing to do. So I personally feel very lucky that I ended up in San Francisco.
Right.
I know there were cheaper schools, but I would absolutely have picked San Francisco any day.
Absolutely, and among the California, I think UCSF is one of the better value for money schools.
Absolutely.
So yes, that is there, and sometimes there is a debate between a good clinical program and going to one of the schools which is more value for money. But what I think, or Shreyash can add on to that, like if let's say I'm doing 10 crowns and graduating, and compared to Shreyash who is doing 15 crowns and graduating, will that 5 crowns make a huge difference?
No. It will not, but you have to remember that trade-off, you're paying a lot of money.
Absolutely.
So make sure that you're okay with that difference. Basically, when you pay all that money, you want to get as much
as you
out from every dollar,
right,
that you're putting into the school.
Absolutely.
So if all the other factors are being fulfilled, then I guess 5-10 crowns here or there won't make any difference.
Makes sense. And you after graduation, you applied for a lot of jobs around. Did any of the employers ask you which school were you from? Let's bust the myth about Ivy League schools, or like this school is better than others, or this candidates from this school get selected or get paid more over another school. Is there anything like this?
No, nobody cares as long as you have a DDS or DMD and a valid license to practice dentistry.
Absolutely. Yes, makes sense. And that's where we come to the third point. How do you differentiate? What are the important, let's say if the family is not in the picture, or 2 schools are almost at the same cost, then third my guess would be somewhere we look at the clinical program.
Absolutely.
So what are the good characteristics of good clinical program?
That's a very interesting question, because there are many factors at play. One of the most important factors would be you have to try to figure out if there is any free time, or how many patients no-show, or even if, let's say, a patient does no-show, what does your college or university expect you to do in that free time? Are there other options available? Because you know, the clinical part is one aspect, but there are so many other things that you can explore while you are at university.
Yes, exactly, like clinical and as well as administrative. There are schools where you need to wake up at 6 a.m. just to book your chairs at different sections, like for pros or endo or treatment planning or something like perio. You have to open up chairs and you have to book your clinical chair on those particular dates, and it gets over pretty soon compared to different schools where you have a scheduled chair time where you can do all the procedures. Right?
Absolutely.
And at the same time, clinically, programs, what you can see if the programs will they let you place implant or not, but that's not a big thing, because even if they let you do it, you may place one implant.
Yeah,
that's it, and it doesn't make any sense, right?
It's not going to make a significant difference to your clinical exposure, but you know, in the end, what also matters is sometimes you might just feel really happy with a program when you interview, right? Regardless of cost or place, if being there makes you happy, that might just be the right program for you.
Makes sense.
If it is one of your options,
right? And also, one of the way to know about how much patient exposure they have is to look at their requirements. If the requirements are more, there is good possibility that they may be doing more clinical procedures, because at the end, every school wants their candidates to pass DDS.
Absolutely.
So that might be one of the good ways to look at.
Absolutely, I agree.
And I think tertiary, like after you exhaust, like say everything is okay, and then let's say everything is same when you want to select to different school, like cost of living of the city, tuition and everything same. Is there anything apart from, I think, weather, right?
Weather can be a factor.
Or a big city.
Big city can be a factor for sure. Location. But you know, like I mentioned, it might just be that you just love the program. It might be in the middle of nowhere, but if you really enjoyed the people around you, it could be the best decision for you for the next 2 or 3 years, and get to make memories that will basically last a lifetime. Right.
I completely agree with him. And also with respect to residency, there are a lot of programs which have GPA as well as pass and fail system. Right. In my perspective, I think pass and fail or GPA doesn't matter much. Yes. It's up to you how much you can get from the program, how much more or how less. It's totally up to you how much you can extract from a program. And there is always ADAT exam to be given, just in case if you really want to show the admission committee that you are the one for them.
That is an excellent point, because when I was applying for residency, a lot of candidates were under the impression that, oh, you don't have a GPA, it's going to be very hard. Right. Almost impossible, because program directors don't have a gauge of how well you did. But I am in a program, and I'm in an excellent program, so it really didn't matter. Right. They look a lot, they give a lot more importance to your letters of recommendation, your dean's letter of recommendation, because that can very often have your class position, if not your class rank. You know, the top, whether you're in the top 20%, middle 20%, right? You know, something like that. So that itself can be a very good gauge if you are planning to apply for residency. The GPA does not matter.
No, I agree. And this might be a personal bias, but I think we all had a lot of stress already in our life while we are getting into DDS. And pass and fail might be one of the good options where you don't have to stress anymore for struggling to get high GPA or low GPA. And even pass and fail programs, you can always get score later higher and get those honor grades. That's how you can improve your profile, I think. And that's about the whole school, right? Yeah. Is there any more points you would add in selecting a program?
No, I think we covered everything. That had to be discussed. There will always be questions very specific to each individual coming up, but you know, you have to cross those bridges when you come to them. Right. It's a very good problem to have.
Absolutely, absolutely. And make sure that you always talk to the candidates who are already in the school, who know about the school. That will be they are really a great asset to tell you more about how the program runs.
Absolutely.
and more or less you are in USA, you can't go wrong with any school so far.
Yeah.
I think all the schools you will graduate with DDS, and in spite of you graduate from any schools, after graduating you either do residency, even if you do general dentistry, you will always have to do those CE courses to make yourself competent and be on top of it.
Dentistry is one of those professions that you're always learning, regardless of how many years of experience you have. So, you know, these 2 years, yes, they'll build your foundation, but anything on top is completely up to you.
Absolutely. And that's about it. I think we covered everything, and if you have any more specific questions, do comment below and let us know. We are happy to help you, and we wish you all the best in all your future endeavors, and you can always reach out to us. Thank you so much, Shreya Shoza. It was a pleasure talking to you.